So, what are defibrillators exactly? It is a device that provides an electric shock to your heart to allow it to get out of a potentially fatal abnormal rhythm or arrhythmia. There are four main categories that you can classify defibrillators into. Firstly, being AEDs. They are portable and user friendly, equipped with voice prompts and visual instructions. They're often found in public places, for example, Sunway Putra Mall and Taman City Tibangsa. Secondly, are manual defibrillators. They are often used by medical professionals in hospitals or ambulances. They usually range about 20 to 40,000 ringgit Malaysia. Thirdly, implantable cardioverter defibrillators, also known as ICDs. They are often surgically implanted for long-term use, and you would usually need a change every 10 years or so. Lastly, variable cardioverter defibrillators. This is better known as life vest, where you wear like a jacket.
What exactly is the relationship between defibrillators and heart anatomy? To answer that question, let's first explore about the heart anatomy. Heart anatomy consists of two components, which is the chambers and also conduction system. Both of these components ensured synchronized heart contractions for effective blood circulations. So what exactly the defibrillators cures? The defibrillator helps the heart to restore its normal rhythm from arrhythmias. Example of arrhythmias is ventricular fibrillation, or in short we call it VF. It happens when the heart beats chaotically and produces ineffective contractions. Another example of arrhythmias is ventricular tachycardia, or in short we call it VT. It happens when the heart beats rapidly and produces inefficient rhythm. So how the defibrillator works to save lives? The defibrillator delivers an electric shock to depolarize the heart muscles. In results, it resets the conduction system and allows the SA node to resume pacemaking. Early defibrillation is very important because it can significantly increases the survival rates of patients.
CPR or cardiopulmonary resuscitation is the first line of response. It involves chest compression and restricting breath to keep oxygen-rich blood circulating until advanced care arrives. The goal of CPR is to buy time, keeping the person alive until a defibrillator or emergency service can intervene. However, CPR has limitations. CPR doesn't address the root cause of most cardiac arrest, usually electrical issues like ventricular fibrillation. This condition causes the heart to beat chaotically or too fast to pump blood effectively. While CPR keeps blood moving temporarily, it cannot correct these arrhythmias. Additionally, CPR must be performed correctly and start immediately to be effective. Unfortunately, improper technique or delay can reduce its success.
So, what is CPR and how do we actually perform it? To better understand this, we went to the ED department in HKL, where Mr. Amza actually was kind enough to lead us through the entire process, briefing us for over 2 hours on CPR and AED.
Okay, tapi kalau untuk basic CPR, the algorithm from the record kita follow DRSABCD. Kita DRSABCD is D adalah danger, R adalah response, S adalah shock for help, okay, A adalah airway, breathing, circulation, and then D is defib.
After almost an hour-long briefing about CPR, we decided to try our own hands at it.
Dr. ABCD first, assess danger. Check outside first, okay, and then check surrounding and patient. And then Dr. R, check the response by tapping the patient's shoulder. Kalau dia response, tak perlu chest compression ke apa.
Sorry, just not tap, but have to shout.
Shout, name also.
Shout lah.
Sir, are you okay? Contoh lah.
Shout, like, sir, are you okay lah? And then S, Dr. S is shout for help. So call 999 and shout for AEDs, defibrillators. And then A, airway. If it is medical cases, you have to chin lift.
Patient, you tolak daya dia. Yes, and then you change it. Okay, change it. Lepas dah sikit nama. Dan change it.
Okay.
Then
Chin there, and then check whether the airway is blocked or not.
yeah,
Then
it will be clear.
kalau airway tak clear, kita clear.
Yes, you have to clear.
A, B, breathing. Breathing. Check whether the patient has a chest rise or not. For layperson lah. Check whether the patient has chest rise or not. Kalau tak ada, then continue with C. Chest compression. Chest compression. Kalau adult, kita akan guna dua tangan. First hand, put the apa panggil ni, the tulang dekat tapak tangan ni at the center of the chest ataupun one third of the chest ataupun selari dengan nipple line dia. And then lock with the other hand. And chest compression about 120 beats per minute. That's about 2 beats per second. So 1, 2, 3, 4. Chest compression. And then kalau the patient did not regain consciousness, call for defibrillator.
This is where defibrillator play a vital role. Defibrillator deliver an electric shock to the heart, resulting in rhythm and addressing the root cause of cardiac arrest. Timing is crucial. For every minute of delay in defibrillation, survival rate drop by about 10%. Using a defibrillator within 3 to 5 minutes can increase survival rate to as high as 70%. AED have revolutionized cardiac arrest response. AED are portable, user-friendly device designed for public users, even by individuals with no prior training. They analyze the heart rhythm and deliver a shock only when necessary, minimizing mistake. Studies show that AED deployed in public places like school, airport, and gym significantly reduce the time between cardiac arrest and treatment, improving survival rate. For example, research conducted in Chicago airport demonstrated that untrained bystanders successfully use AED to save life in emergency situations.
So, what about AEDs? How do we use them?
Tak apa, buka sampai boleh. Tengok instruction, the first instruction. Dah call dah shut for help, betul? Next step is open. Next step is kan? So next, kami dah buat apa? Dah sampai dah dekat chest. Cuma dekat back tu dia ada gambar dia. Pasal satu dekat mana, satu dekat mana. Tak boleh sudah buka. Alright, kita tu. Jadi, apa ada 3 benda tadi tu? EMS arrive, patient regain consciousness, and then
Okay, itu je untuk kegunaan AED rakan-rakan. Maka sedarlah AED ni penting.
Beyond AED, advances defibrillator technology include the life vest and ICD, implantable cardioverter defibrillator. The life vest is a wearable defibrillator designed for patients at high risk of sudden cardiac arrest. Unlike AED, which are used using emergency, the life vest is lightweight and comfortable. It allows patients with conditions with long QT syndrome or pericardial arrest to go about their daily life with peace of mind. For long-term protection, ICD are a small device implanted under the skin near the collarbone. They continuously monitor the heart and deliver electrical impulse to restore normal rhythm in the event of arrhythmias.
Like any electronic device, defibrillators can experience malfunction. Common issues include sensor faults, software glitch, and battery failures. These malfunctions can be critical, especially when the device fails to deliver a life-saving shock at the right moment. Additionally, some defibrillators struggle with accurately analyzing heart rhythms, particularly in complex cases. This can lead to misidentifications, where non-shockable rhythms are treated as shockable, or vice versa, potentially resulting in inappropriate shocks or missed life-saving opportunities. Now we move to the ethical concern. Access to defibrillators is not equal for everyone. Socioeconomic disparities mean that some communities have less access to these essential devices. This raises serious ethical questions about healthcare equity. Technological advancements, particularly in artificial intelligence, are playing a crucial role. Machine learning algorithms such as convolutional neural networks have significantly improved the accuracy of arrhythmia detection. These algorithms help distinguish between normal and abnormal heart rhythms, reducing the risk of inappropriate shocks and improving patient safety. Another important innovation is the development of adaptive electrode designs. These designs account for individual anatomical differences, improving energy transmission and overall device effectiveness. Additionally, using more robust materials can enhance the durability of defibrillators, making them more reliable over time.
In conclusion, here is some key points and also a small summarization of what my team members have presented. Defibrillators have revolutionized cardiac care by restoring normal heart rhythm and preventing sudden cardiac death. Advances like biphasic shock delivery have improved their safety and efficiency, making them indispensable in public and clinical settings. Throughout this discussion, we have highlighted the key innovations defibrillator technology. Despite these successes, there are challenges such as device malfunction and access disparities remain. Future advancements in AI, electrode design, and remote monitoring aim to address this issue. Public education and training are vital to maximizing the life-saving potential of defibrillators and shaping the future of cardiac care. Now I'm going to share about the anticipated future research. The future of defibrillators is being shaped by advancement in AI, IoT, and 5G, which are enhancing their functionality through predictive algorithms, improved shock accuracy, and real-time remote monitoring. These technologies will enable seamless integration with smart systems, automating emergency responses, and improving data sharing with healthcare providers. Further innovations such as biocompatible materials and efficient energy storage will create longer-lasting devices that reduce tissue damage during shocks. Miniaturization will make defibrillators more portable and wearable, increasing their usability and comfort for patients. Hybrid devices combining defibrillation with advanced monitoring or drug delivery represent another exciting area of progress. With continued research and innovations, defibrillators will become even more effective, accessible, and vital in reducing the global burden of cardiac arrest.